Hi, I'm Clio. I'm an author and I've just written a book called Get Your Mojo Back: Sex, Pleasure and Intimacy After Birth. This is Amanda Savage. Amanda is an expert physiotherapist and someone who has contributed greatly to the book with all of her knowledge. And so today we're going to be talking to you and each other about what physically affects us after birth and how that might impact our experience of sex and intimacy. Hi, Amanda.
Hello, thanks for having me.
You're welcome. Pleasure, as always. So let's start there, shall we? What is it that might physically impact us, particularly with regard to sex and penetrative sex in particular as well, after birth? Because I know there are lots of different ways that our body can react to birth, and that depends whether it's vaginal or C-section, and then there are various other things within that as well. So I'd love to hear some perspective from you.
Well, I think our key thing is to know that birth is so physical. We know that being pregnant's physical, but however you deliver your baby, there's no escaping that it has a physical impact on your body. And nothing's big enough to get a large baby out. It's a miracle how the body can adapt and stretch, but it leaves us with some fallout and some recovery to do afterwards. And so we've got an impact on the pelvic floor and perineal tissues underneath if you had a vaginal delivery. You've got impact on your abdominal wall, and that impacts on the underneath and the pelvis if you had a caesarean delivery. There's no escape route. And then we've also got our mums that have done both.
Yeah.
I mean, if you had an emergency caesarean, it's usually because you did the whole practically vaginal experience first and then had your caesarean. So you've had a lot of impact in two places.
Amazing. Or not amazing,
No,
as the case may be.
Yeah.
But really interesting, because I think a lot of us don't really appreciate the impact that birth can have on our bodies until afterwards. You know, a lot of the focus is on pregnancy and the lead up to childbirth, and then we don't talk so much about how to rehabilitate properly and how to get back to or move forward into our new bodies after that experience. So can you talk a little bit about why don't we start with caesarean sections and how that can, you know, how the actual physical cut through the many different layers of tissue can impact how we're doing afterwards.
Yes, so if you have a caesarean delivery, it is a cut that's been done on purpose and as neatly as possible with the intention that it will heal, exactly like if they're going to do knee surgery or surgery anywhere else in your body. And so it goes through multiple layers, even though you can only ultimately see the scar on the surface, all the way down through fascia and muscle to get to the uterus. Now, each layer will be stitched up carefully. And mums who've had caesareans will remember that getting the baby out is quite quick, but actually spend quite a long time in theatre with them carefully tidying up all those layers to give you the best result. And a caesarean section will recover naturally extremely well. Hence, people could go on to have another one. 2 or 3 is usually the maximum. So nature's incredible how it can heal, but we want to think about how we can help it along as well. And the most important thing is that the surface layer, the skin layer, needs to be nicely sensitized afterwards. So one of the problems can be that it can feel very numb or very sensitive afterwards. And then the underlayers, the muscle layers, if you cut through a muscle and stitch it, it will function again, but your brain might not want to let it function again for a while. And you may have to spend quite a bit of time purposefully reconnecting with how it works and how to get it to work. And you can't just dive straight in. You have to respect the fact that it's been cut and stitched. And so we have a healing phase of about 6 weeks where you can't really do too much to help it along. But once the caesarean scar's healed, you can look after the scar and help it produce the best possible nice stretchy scar. And you can work on your muscles so that they will learn how to work again and help support you as you're carrying your baby around.
So can you tell me a little bit more about how a vaginal birth then might impact us physically afterwards? Because, as you say, a caesarean is very obvious in terms of the scar that it leaves us with. But perhaps, you know, you might think you're recovered vaginally and you're experiencing some issues and you're not really sure why. So how can a vaginal birth impact us?
Yeah, so I think we underestimate what happens below with a vaginal delivery, perhaps reinforced by the fact that you're given your baby and sent home quite fast, which kind of infers, oh, not much happened, and here's a baby to look after.
Mm-hmm.
But those tissues underneath are all what we call soft tissues. They're muscle and fascia and skin, and they're fed by nerves and blood vessels. And it's an amazing thing that the body can go from a tiny hole and let a baby's head out through it. And it's only possible because of all our amazing hormones at that stage. But you can't stretch muscles and fascia and skin right out and then they just ping back and off they go. It would be lovely, but it's not realistic. So most women are going to have bruising, swelling, and some kind of graze or small tear that's had an odd stitch, or as we all know, many people have a big tear naturally that has to be stitched, or an episiotomy, which is a physical cut that gets stitched. So very few women are just popping babies out. And there are a lucky few, yeah. But even those people know that they had bruising and swelling and soreness. Mm-hmm. But I think maybe it's easy to think that that's just for a couple of days. Mm-hmm. But again, if we think about healing of soft tissue takes at least 6 weeks for your body to do all the things it needs to do under the surface. Mm-hmm. And yet in those 6 weeks, you're looking after a heavy lump of a baby in a car seat and a pram, and it's all going on, not much sleep and difficult to eat well.
And you might be learning to breastfeed.
Yes.
Or
yeah, definitely. And that's a whole new learning skill.
All of the other ways that you're trying to keep a baby alive as well. So it's a difficult period. So
definitely
give yourself a break.
Yeah. And we've got 2 physical things to keep an eye on. What's happening on the surface layers where you might have had some scarring or some stitches or just a lot of overstretching? And how are you going to help those surface layers stay nice and flexible and movable as they're healing, so that you don't get like a funny tug when you try to squat down to pick up the baby, or when you get to having sex again, we don't want pain or discomfort in those surface layers that will make you go, oh, stop now, that hurts.
And also numbness.
And yes, or the opposite would be it feels very numb because the nerves have been affected. Mm-hmm. And then deeper, we need to make sure that the pelvic floor muscles that the baby's heads come through, it can go one of 2 ways. Everybody thinks of the fact that the muscles can be very weak from being stretched, and then you're going to be aware that you feel numb, you feel different, you feel maybe there's too much space. Mm-hmm. And how do you get back that sense of tone and structure and the ability to squeeze on your partner and feel sexually yourself again? Mm-hmm. But at the same time, we could have also the problem that the muscles have been guarding and protecting you since the moment that baby was born, because it was painful or traumatic, or just because that's what the body does to look after itself. And actually, a lot of mums have problems with finding that they've become quite tense and they're guarding and protecting with their pelvic floor. And they don't even necessarily know you're doing it until you try to resume sex or sexual activity. And then you find that touching your muscles or this area of the perineum is painful or really tender or bruising. And it can be quite a surprise.
Yeah.
And so those muscles actually need to learn to let go and relax rather than strengthen as their priority. So all mums have got to look at themselves from the belly buttons to the knees and think, what's been affected? How can I help that healing process along?
And can I ask as well about mums who have had a caesarean birth? Obviously, we've talked about the impact of the scar and some of the healing that will need to do. But that doesn't necessarily mean that your pelvic floor hasn't been impacted if you've had a caesarean birth as well. We mentioned it at the top of the video, but you may have had one birth that was a caesarean delivery and one birth that was a vaginal delivery. Or as Amanda mentioned, you may have gone all the way through nearly having a vaginal delivery and then had a C-section. So you know, it's important just to realize that you may be being affected by some vaginal issues, even if you've had a C-section birth. And also that, you know, your pelvic floor has also been carrying a baby for 9, nearly 10 months. So there will be some of those kind of impact on the muscles as well, even if you ended up having a C-section, if it was planned or not.
No, that's exactly it, Clio. The pregnancy itself is a load on the pelvis. So being pregnant is thought to have as much impact on your physical changes as the actual delivery. And that's why so many people who've had a caesarean can also end up problems with leaking from their bladder, or some elements of prolapse, or problems with sex after having their baby, even if you think that it came out through the top.
Yeah.
So I think that idea that you should be checking what's gone on for you from above your belly button to your knees,
yeah,
and whichever way you delivered your baby is really important.
Thank you.